Hello, my name is Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to offer ways to accommodate a pelvic exam for individuals who need special assistance. Persons with intellectual or developmental disability, often called IDD, may experience anxiety at the doctor related to unfamiliarity with the situation or a past experience of difficult medical encounters. Lack of cooperation may be related to anxiety and can create challenges in examining some patients. Many persons are taught that the pelvic area is private, bad touch part of the body, which can create an additional challenge in cooperation. Persons with IDD may have experienced sexual trauma in their past. The first step is to consider how to best adapt your communication to fit the person. Ask about abilities in both receptive and expressive language. Acknowledge accompanying persons and verify their roles. Remember that the accompanying person may not be a trusted helper, and the patient may not want that person in the room for a private history or exam. Key points in communication are: speak directly to the individual, specifically seek consent or assent when performing an exam or procedure, explain and demonstrate. Info is easier to understand when large ideas are broken into small parts. Visual tools can be helpful. Speak and move slowly. Processing speed is often slower for individuals with IDD. You might even need to allow 15 to 20 seconds after asking a question to get the response. Use simple and comforting language. Use repetition and recap key points at the end of the conversation. Praise cooperation. Take 5 or 10-second breaks when needed. Try to build a good and comfortable rapport with a patient before broaching the topic of a pelvic exam. Once trust has been established, then it is reasonable to recommend an exam for preventive or diagnostic purposes. Begin with an explanation of the planned exam, preferably during an appointment in advance of the actual pelvic exam, particularly for someone who has never had one or is apprehensive about it. Many women with IDD have not been through formal sex ed, and their knowledge of female anatomy may be very limited. It can be helpful to ask what they know before you explain the exam. You can demonstrate on a model or use pictures or a video to help with your explanation. You can show your equipment: stirrups, specula, brush, spatula, and swab. You can allow the patient to hold the equipment and see how it works. Reassure that the exam may be uncomfortable but should not be painful. Teach that she may request you to stop the exam at any point. Seek consent or assent. If there's hesitancy, encourage the help of a trusted accompanying person. It may be helpful to have a conversation about the differences between good touch, bad touch, and necessary touch. Good touch makes you feel happy, safe, and comfortable. Bad touch makes you feel forced, hurt, or afraid. Necessary touch can describe touch that might not feel comfortable, but that you still agree to for your own health. You may want to help the patient seek the input of a trusted support person. Once you have obtained consent or assent, ask about options to best distract or incentivize the person to ease the exam. Some women may prefer to watch their exam by using a mirror. Other women may prefer to watch a video or engage in a conversation for distraction. Review relaxation techniques to assist in relaxing the pelvic floor muscles, including letting the knees fall open, taking big breaths, and counting. At the time of the exam, consider whether your patient can change into a gown or get on the table without assistance. Indicate proper gown placement. If there's not a support person who the patient wants to be present, offer a chaperone. Direct your patient in placing her heels in the foot holders and moving her bottom into the correct position on the table. Assist as needed. Approach the exam gently and slowly. Tell your patient in simple language what you're planning to do before actually touching. Encourage relaxation. Offer 5 to 10-second breaks and remind of relaxation techniques like deep breathing and allowing the knees to fall open when needed. Start by examining the inguinal region and external genitalia, progress to the bimanual exam, This allows you to feel for pelvic floor tension and help remind her to relax. It can also assist in choice of specula. When attempting a speculum exam, advance the speculum slowly. If she is too tense or the introitus is too small for your speculum choice, you may perform a finger-guided specimen collection for PAP by finding the cervix with your finger and using your other hand to direct the spatula and brush to the cervix for sample collection. If it is indicated, move to the rectal exam. Start with an explanation of this next step. Start with external touch by just placing the finger at the anus. Assist and encourage your patient to relax. Offer the option to bear down to help open the anal sphincter before you insert your finger. If at any point your patient requests an end to the exam, stop immediately and praise her for cooperating to the best of her ability. Restraint, coercion, or forcing part of the exam should be avoided. If there's an emergency reason for the exam, sedation may become necessary. Once you have completed the exam, advise your patient to scoot back on the table and assist her in sitting up if needed. Discuss any findings and recommendations, answer any questions, and give her specific direction for follow-up or next steps. Thank you for watching. To assist your patients in preparing for a pelvic exam, you can refer them to the partner videos at 4rhealth.org.